I will be talking about Chapter 55 in the text on laryngeal papilloma. Laryngeal papillomatosis is also known as recurrent respiratory papillomatosis. It is a rare medical condition that leads to audible changes in voice quality and narrowing of the airways. Papillomatosis is the most common laryngeal neoplasm and it is believed to be caused by the human papillomavirus or HPV. A papilloma is a benign epithelial tumor. It is caused by type 6 and 11 of the human papillomavirus, in which benign tumors or papillomas form on the larynx or other areas of the respiratory tract. A score of 0 to 3 is assigned for each location of the papilloma. 0 for absent, 1 for surface lesion, 2 for raised lesion, and 3 for bulky lesion. Above you see a normal larynx on the left and one with a papilloma. It is known to present in a bimodal ages distribution with a range from a few days of life to the 9th decade. The first peak is in children, the majority present between the first year of life to age 5. The second peak occur around age 30 to 40. In this slide, we will be talking about transmission. The vertical transmission theory states that infants are infected by their mothers during delivery through the birth canal. The mother's genital tract acts as a reservoir for human papillomavirus, which infects the infant's aerodigestive tract. Less is known about the disease transmission in adults. The disease is male dominant by a ratio of 2 to 1. However, it is suspected that adult onset recurrent respiratory papillomatosis is a sexually transmitted disease. Nearly all patients with laryngeal papillomatosis present with hoarseness, aphonia, chronic cough, respiratory distress. Patients with these symptoms should undergo a complete history and physical examination, including a laryngoscopy. The disease is highly unpredictable, with recurrences occurring at variable rates. Frequent surgical intervention may be required to maintain a patent and functional airway. Clinical characteristics that may point to malignant degeneration and a papillomatosis lesion have been identified as onset of dysphagia, sudden and rapid growth rate, subglottal extension of disease, and limited vocal mobility. Treatment is currently surgery. It is the primary modality of treatment for recurrent respiratory papillomatosis. For prevention, the development of vaccines against papilloma have been a major advance. If children are vaccinated before they are exposed to the virus and before they are sexually active, a significant papillomavirus infection may be eradicated. It is advised for males and females.